Hey guys, did you know that 2020 census of the Virgin Islands is still happening?
Yes, they was just by my house yesterday.
I heard they really need our help counting the entire population of the Virgin Islands.
Because the information that you give to the census will help our community to receive federal funding over the next 10 years.
I'm not giving a man my personal information.
All your information is confidential
And is protected by federal law.
Did you know the results will affect how much we receive in federal funding that can be used for schools, roads, healthcare, and so much more?
We're working hard to visit every home and interview every person in the U.S. Virgin Islands.
We comply with local health and CDC guidelines for your safety and ours.
They came to my house and I wasn't home, but they left a note. How do I make sure I'm counted?
You can call them and complete the census over the phone.
It's super quick and super easy. So do the right thing and complete the 2020 census of the U.S. Virgin Islands.
And be counted.
Hey family, it's Reverend Jermaine Mully here. Every Sunday morning, 8:30 a.m., join us as we take a dive and a walk through this series, Messages of Hope.
Wash your hands. Hey, you violent, my boy. Well, every time that you get touched, you have to wash up your hands. Put on your mask, practice some distance, stop spread corona. It's Adamo. And on behalf of the Virgin Islands Department of Health, hold it down on all the mass gatherings. Wearing a mask not only protects you, but it protects your loved ones and your community. Help stop the spread corona.
Good afternoon to the viewing and listening audience. My name is Richard Motta, Government House Communications Director. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of November 16th. I am joined this week by Territorial Epidemiologist Dr. Esther Ellis, who will provide the PUI update on behalf of Commissioner of Health, Hussein Encarnacion, as well as some updated information on the Territory's COVID-19 screening protocols and how you can contact the department if you suspect that you have come into contact with someone who may be COVID positive. I am also joined today by the Director of the Virgin Islands Division of Personnel, Ms. Dayna Clendenin, who will provide an update on the new Medicare Advantage plan for government retirees 65 and older, and also to provide some clarification on the AARP correspondences. Most of them have received recently. So I will now turn over the briefing to Dr. Ellis for the PUI update. Dr. Ellis?
Good afternoon, everyone. As of November 16, 2020, the Department of Health has tested a total of 26,110 individuals, of which 1,434 have tested positive and 24,635 have tested negative. There are currently 40 active cases in the territory. 1,370 cases have recovered, with 23 fatalities related to COVID-19. From our hospitals, Juan F. Louis Hospital and Medical Center reports no COVID-19 cases. Schneider Regional Medical Center reports 1 positive COVID-19 patient. Our epidemiology hotline is still open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. We are in a good place with laboratory testing capacity, where individuals have several options available for testing. A list of testing sites can be found on our website at covid19usvi.com. The Department of Health's epidemiology hotline is one of those options. Please call 340-712-6299 or 340-776-1519 to report symptoms or if you have been in contact with a confirmed case. The weekly positivity rate is up to between 3 and 4%. As cases increase, mitigation must remain strong to avoid additional restrictions. COVID-19 vaccine planning and airport testing and screening remains the main focus of the department. The Department of Health is in step with the entire nation in preparation to receive a federal distribution of the COVID-19 vaccines. It will be distributed in a prioritized manner. Electronic contact tracing is being utilized to track all positive cases, contacts of positive cases, and soon will be implemented to track all people entering the territory for the incubation period of the virus. We continue to increase testing, and we are detecting new cases daily. This allows us to monitor positive cases and place individuals in isolation or quarantine. Close contact is still the highest mode of transmission, followed by community transmission. You must be mindful of your interactions and also self-aware when it comes to noticing changes in your overall health. By identifying possible exposures and reporting symptoms early, you can avoid spreading COVID-19 to those around you. The department has observed more and more mass gatherings by way of crowded businesses and special events. The Department of Health is here to guide you and assist you in organizing your event in a safe manner. We want to lower or eliminate the risk of your event being the origin of a new outbreak. We don't want people to get sick from celebrating what should be a happy moment, and there are some guidelines you should follow. Remind guests to stay home if they are sick, or if they have been exposed to COVID-19 in the last 14 days or are showing COVID-19 symptoms. Anyone who has had close contact with a person who has had COVID-19 should stay home and monitor their health. Invited guests who live with family who are at higher risk, such as the elderly or immune-compromised individuals, should also consider the potential risk to their loved ones. Consider keeping a list of guests who attended for potential future contact tracing needs. Host your gatherings outdoors when possible. If this is not feasible, make sure the room or space is well ventilated. For example, open windows and doors. Arrange tables and chairs to allow for social distancing. People from the same household can be in groups together and don't need to be 6 feet apart, just 6 feet away from other families. If planning activities for adults and or kids, consider those where social distancing can be maintained. When guests arrive, minimize gestures that promote close contact. Wear masks when less than 6 feet apart from people or indoors. Consider providing masks to guests or asking them to bring their own. Consider providing hand sanitizer in addition to clearly marked hand washing areas. Encourage guests to also bring their own supplies. Wash your hands for at least 20 seconds when entering and exiting social gatherings. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Make sure there is adequate soap or hand sanitizer containing at least 60% alcohol, available in the restrooms, and encourage guests not to form a line at the door. Consider also providing cleaning supplies that allow guests to wipe down surfaces before they leave. Remind guests to wash their hands before serving or eating food. Use single-use hand towels or paper towels for drying hands, so guests do not share a towel. Limit the number of people handling or serving food. Limit people going in and out of the areas where food is being prepared or handled, such as in the kitchen or around the grill. If serving any food, consider identifying one person to serve all food so that multiple people are not handling the serving utensils. Use single-use options or identify one person to serve shareable items like salad dressing, food containers, condiments, so that multiple people are not handling the items. Limit contact with commonly touched surfaces or shared items, and use touchless garbage cans if possible. Use gloves when removing garbage bags or handling and disposing of trash. Wash hands after removing gloves. Also, clean and disinfect commonly touched surfaces and any shared items between use when feasible. If you choose to use any shared items that are reusable, such as seating covers, tablecloths, linen napkins, wash, clean, and sanitize them after the event. For assistance in safely organizing your event, please email environmentalhealth@inspection.deh@doh.vi.gov. In addition to individuals attending parties and events locally, many residents are traveling to the mainland for weekend trips to attend events and parties. It is critical that residents who travel follow the travel guidelines we have shared previously. Health Commissioner Justa Encarnacion has discouraged residents from non-essential travel and is concerned of an increase in COVID-19 cases in the U.S. mainland. We continue to see cases rise nationally and unfortunately locally. Travel increases your chance of getting COVID-19. Staying home is still the best way to protect yourself and others. While you are discouraged from non-essential travel at the moment, some individuals who must travel for essential reasons, please visit usviupdate.com for travel requirements. It is important to remember that all travelers to the U.S. Virgin Islands aged 5 and older must produce either a negative COVID-19 antigen, molecular, PCR, or rapid test result taken within 5 days prior to travel, or a positive COVID-19 antibody test taken within 4 months prior to travel. Every traveler aged 5 and older must use the travel portal at usvitravelportal.com before travel. This goes for residents and visitors alike. Children 4 years of age or younger are exempt from this testing requirement. For those of you that travel and have family and friends traveling to meet you, please remind them of the importance for them to be tested before they come. It is critical that if you know you've been exposed to the virus or suspect you've been exposed, you must quarantine and stay at home and away from others while waiting for your test results. We all need to do our part to continue to keep our community healthy. To keep up with our daily reports, please visit U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis, for that very important and critical information. Before we move on to our other COVID-related updates, we have with us, again, the Director of the Division of Personnel, Ms. Dayna Clendenin, who has an update on the Medicare Advantage plan, as well as the AARP correspondence that was recently sent out to government retirees 65 and older. Director Clendenin.
Thank you. Good afternoon to the listening and viewing audience. Again, my name is Dayna Clendenin, and I serve as the Director for Division of Personnel. I am pleased to join Director Motta at today's press briefing to speak briefly once again on the new Medicare Advantage plan, as well as offer some clarification on the AARP correspondences that many of you have received. As mentioned when I was here on September 28th, government retirees over the age of 65 and their dependents as of January 1, 2021, will have the awesome benefits of $0 copay for all doctor visits, $0 deductible, a $500 allowance for vision and hearing aid exams, free virtual consultations with nurses 24 hours a day, 7 days a week, free access to fitness centers or the gym, gift reward cards for house calls, such as virtual preventative checkups. And what is also convenient about this plan is carrying just one card for all your medical needs. No confusion and no need to carry the red, white, and blue Medicare card. Now, I know you're wondering, what does this cost? Well, for those retirees 65 and older who are currently on Plan F or G, there will be no additional cost. What is even better, you will see a decrease in your premiums. I know, I'll say it again. You will see a decrease in your premiums. Now that's good news. Well, for my retirees on Plan N, you will see a slight increase of no less than $3.77, but no more than $7.52 to enjoy all the Medicare Advantage plan benefits. So allow me to provide some clarification on the coupon book or the 2021 premium letter from the AARP Medicare Supplement Plan that most of you received. Unless you have an individual plan with AARP, you are to disregard those items. If you are a retiree over the age of 65, covered under the Virgin Islands Health Insurance Program with no individual plan with AARP, the coupon book or the premium letter does not apply to you. Now, if you have an individual plan, such as a hospital indemnity plan through AARP, you will need to continue to make those payments directly to AARP. As such, I strongly urge you to contact the local AARP office at 340-713-2002 for more information on that plan. And lastly, as United Healthcare transitions to the Government of the Virgin Islands Medicare Advantage Plan, effective January 1, 2021, and moves away from the AARP plan, you may receive a termination letter. Again, please do not be alarmed. You will not lose your coverage. Now, I know I've said a lot of words today, so if you still have questions or concerns or want to learn more about the program, please call my office. We are happy to serve you at 340-774-8588 or 340-718-8588. You may also contact United Healthcare at 866-827-9022. And for my savvy retirees over the age of 65, you can log on to uhcvirtualretiree.com/GVI. Listen, I would be remiss if I did not take this opportunity to thank the Honorable Governor Bryan and Honorable Lieutenant Governor Roach and our partners at United Healthcare, VI EchoCare, the awesome staff at the Division of Personnel, and the GESC Board on this significant accomplishment of bringing this much-deserved, long-anticipated benefit to the government retirees of this territory. I thank you so much for your time. Remember to stay masked, sanitized, and safe.
Thank you, Director Clendenin. Much deserved indeed. So for an update on the unemployment numbers, as of yesterday, Sunday, November 16th, the Virgin Islands Department of Labor has received 16,952 applications for unemployment benefits and has processed 15,801 of those claims. To date, the Virgin Islands Department of Labor has issued 45,883 unemployment insurance checks, totaling $36,420 to Virgin Islands residents impacted by COVID-19 related job losses. The department has also issued 28,096 federal pandemic unemployment compensation payments, totaling $43.4 million. And in addition, the department has also issued 4,999 pandemic unemployment assistance checks totaling just over $7.1 million, and also issued another $2.4 million in pandemic emergency unemployment compensation payments. That means to date, the Bryan-Roach administration has issued a total of 79,691 unemployment benefit payments to Virgin Islands residents, totaling over $89 million. Now, just as a reminder, to apply for unemployment insurance, visit the department's website at vidol.gov. Again, that's vidol.gov. And also, many of you may know by now, the department has commenced its in-person service in both of their offices, territory-wide, in each district. To date, they've seen a total of over 802 individuals in those offices. Please be reminded that you can visit those offices following the following parameters. And those days for visitation are Tuesdays, Wednesdays, and Thursdays, and from 9 a.m. to 4 p.m. And that will be by a last name. So on Tuesdays, if your last name ends with the letters A through H, you are welcome to visit the Virgin Islands Department of Labor's offices in both St. Croix and St. Thomas between the hours of 9 a.m. and 4 p.m. On Wednesday, if your last name begins with the letters I through P, you are welcome from 9 a.m. to 4 p.m. And on Thursdays, if your last names end in the letters Q through Z, from 9 a.m. to 4 p.m. I'll just go over that one more time. On Tuesdays, if your last name ends with A through H. Wednesday, if your last name ends in the letters I through P. And on Thursdays, if your last name ends with the letters Q through Z. We have some very, very good news on the stimulus front. I know many of you in the community have been anxiously awaiting your stimulus payments. The Bureau of Internal Revenue and the Department of Finance began issuing our latest batch of CARES Act stimulus payments to Virgin Islands residents on Wednesday, November 10th. So that latest round of stimulus payments included 2,923 checks totaling just over $4 million. To date, the Bureau of Internal Revenue and Department of Finance has processed $82,602,604.31 in CARES Act stimulus payments to 50,636 Virgin Islands residents. Just as a reminder, for those of you who have not yet filed your 2018 income tax or Form 1040 for your CARES Act stimulus payment, the deadline to turn in those filings is this Saturday, November 21st, 2020. And of course, the Bureau will continue to process those and issue CARES Act stimulus payments until December 31st, 2020. We also have an update on the virtual learning tools or the laptops from the Department of Education. The Department of Education and our students continue to make progress with virtual learning, and as part of our efforts to make this new normal as seamless as logistically possible for our students, parents, and teachers, the Government of the Virgin Islands and the Department of Education continue to provide the support and resources necessary for our students to succeed. The department has issued to date 2,000 MiFi devices to public school students in the Virgin Islands, 1,000 in each district. In addition to that, they have issued 1,475 laptops to public school students in St. Croix, in the St. Croix district, and 310 to students in the St. Thomas St. John district, for a total of 1,785 laptops. Now, this is from the department's existing school and district inventory. In a direct response to COVID-19, the department has purchased 12,000 Chromebooks for students with the funding provided by Congress under the CARES Act. And as of Thursday, November 12th, the department has issued 997 of those Chromebooks in the St. Croix district and 670 of those in the St. Thomas St. John district. And they will continue the issuance of those Chromebooks as soon as the vendor fulfills the bulk orders, the bulk order requisitions. All students in the territory will receive a new Chromebook as they arrive in the territory. As we close this afternoon, I would like to remind the public, now 1 week into our latest step forward on a path to a new normal, to please continue taking the necessary precautions and to adhere to the guidelines issued by our local Department of Health. These guidelines are in place to keep us all safe. This is particularly important as we approach the holiday season and as we grapple with increased travel to and from the U.S. mainland, while many of those mainland states are experiencing alarming surges in COVID positivity. If you are following the news, you know how bad things are nationally and even here in the region. Please do not take these guidelines for granted. Refrain from planning public events that encourage mass gatherings. I say that again, please refrain from planning public events that encourage mass gatherings. We are doing extremely well in maintaining our numbers and have taken steps forward in our reopening strategy, but many states are not and are taking steps backward. So we need the event planning community to hold off for a few more months until those states can catch up. If you must gather for the holidays, however, do so responsibly and within the guidelines issued by the Department of Health. Limit your family gatherings to persons within your immediate household or to no more than 10 persons. If you are not sure what those guidelines are, you can always find them at the Department of Health's website at covid19usvi.com or at vi.gov. Be responsible, make a plan, and stick to that plan. Your health and that of your loved ones and our community depend on it. That concludes our press briefing this afternoon. We will go to any questions from the media if there are any.
Good afternoon. This is AJ Rao with the Daily News. Good afternoon. This is AJ Rao with the Daily News.
Jay.
Can you hear me now?
Having a little delay there. Go ahead, AJ. Our end.
All right.
I'm sorry, we're having some technical difficulties with our questions. Next question, if there is another one.
Hey, good afternoon, Director Motta. Director Clendenin and Dr. Ellis. How are you all doing today?
Good, and you, sir?
Awesome. This is Luciba Knight from the St. Clair Avis. My first question is for Dr. Ellis. We've been hearing today another pharmaceutical company announced that they have made a major breakthrough in vaccine production. And so the question then turns to who is in line to get the vaccine. Nations from Japan, Brazil, down the line have already put in pre-orders, and I'm wondering where in line is the United States Virgin Islands, and how many doses can we possibly expect, and when?
Good afternoon. That's a really good question, Luciba. Thank you for that. Moderna did recently release the data from their vaccine, as well as Pfizer, which is the vaccine that we've heard about previously. It looks like the vaccine from Moderna is about 94.5% protective, which is incredible. The Pfizer vaccine is also 90% protective, but the Pfizer vaccine requires that the doses be stored at minus 80 degrees Celsius, which is ultra cold freezers, and we do have capacity for that in the U.S. Virgin Islands, but you also have to transport the vaccine on dry ice to providers, because not all providers would have those. So we're looking into both options. We are on the distribution list for vaccines, and we will get the vaccine in the U.S. Virgin Islands at the same time that other states get it.
Oh, awesome. And is there any word on, I guess it might be too early to call, but is there a projection on when that date might be?
I'm not sure. So we've been told that it could be before the end of the year, but it really depends on as soon as the vaccine has been FDA approved.
Awesome. Thank you so much. And then, Richard, this is for you. When does the Department of Education expect the bulk order to be fulfilled? That's a saga that's been dragging out for a while, and we're wondering when the conclusion might, the climax might be.
Sure, Lasiba. And I think one of the important things to remember is that the Department of Education here locally is one of all of the jurisdictions on the U.S. mainland that are requiring additional resources to conduct virtual learning. As you can imagine, the vendors are trying to fulfill those bulk orders from all of the many states and different jurisdictions. So this is not a challenge that is unique to our district. So, I wish I had a date that I can give. So far, the department has been receiving the orders for the last month and have been distributing them as they come. We hope that we can get all of those in and distributed to our students before the end of this year, but that depends on the vendors. So I can't really give you a definitive date, but as soon as we get those resources in, we distribute them to the students and we make that available to the public.
Forgive me if you answered this earlier. What percentage of the orders remains outstanding?
Give me 1 second. Let me get the numbers for you. I know right now they have issued about 1,500. So the large majority of them are outstanding. It was 12,000 Chromebooks to the students. Now keep in mind, I think it's important for the public to understand as well that just because the students don't have these new Chromebooks doesn't mean that they don't have access to virtual learning. And for the students who don't have access to virtual learning, there are written guidebooks that are provided to the students to be able to conduct or to participate in instruction.
Awesome. Thank you so much. That wraps it up for me.
Very much. Are there any other questions? All right, no more questions, or I think we have another one. Do we have another? Okay, we do not have any additional questions. That concludes our press briefing this afternoon. Thank you for joining us. Please be safe, wear your mask, take care.